Hey. Long time no see. I think the last time I got on here, it was before it was determined whether or not I was going to have radiation. I've been meaning to get on here since then, but I actually went back to work a little over a month after my surgery, and I've been back for almost a full month now. I'm not working a complete full-time schedule yet, but pretty much going in every day. It's wearing on me, but getting back to the radiation, I did have to have radiation. So the last time I talked to you, I had a multidisciplinary appointment, and I was going to meet my radiation oncologist for the first time at this joint appointment. And my surgeon I also met with that day. My surgeon told me that I had the choice of removing the rest of the lymph nodes in that area underneath the arm. But regardless of whether or not I decided to do that first, I would still have to have the radiation. So it was recommended by all, my oncologist, my surgeon, the radiation oncologist, that radiation should be a part of my treatment. But the lymph node removal was optional. And I chose to wait on that because it can cause a lot of swelling in the arm, and it's permanent damage. So it would be something that I would deal with the rest of my life, and I would rather, just do the radiation and let everything, heal up and get back to normal. And then my surgeon's going to do an ultrasound and take a look at the lymph nodes and see how they look, and I guess she'll determine then whether or not she thinks that removal of any more lymph nodes is still necessary. I believe I'm cancer-free, but obviously they need to do this part to clean any miscellaneous or microscopic whatever that might have been left over in this area, because one of the lymph nodes they did remove had cancer cells in it. They obviously want to make sure they zap anything that still might be remaining in this area. I've got these markers on the upper part of my body, like one here, in the middle, and then on this side. And the radiation kind of goes through to my back, and it basically covers this area all the way down till right underneath the breast, and then it goes like all under the arm here. I'm starting to feel some skin irritation. I've been in it for 2 weeks now. I have a total of 5 weeks, 25 treatments, 5 days a week. So 5 days in a row, boom, 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 boom. And then I have the weekend to kind of recoup and the cells to rebuild. But it's definitely starting to look and feel like a sunburn in that area. I put an ointment on it several times a day to try and keep it moisturized and to help it heal. But every day like that, it's just it's hard for those cells to rebuild fast enough to really, notice any sort of difference. It's not really until the weekend that the redness kind of starts to subside, and I'm almost right smack in the middle of the treatment schedule, so I'm sure it's probably just going to get a little bit worse. The other major side effect is fatigue, sort of like the chemo, where it would kill the good cells. So, not just the bad, but the good. So your body would be working overtime to rebuild those cells, and it just causes it to wear out quicker. I guess it's the same story with the radiation. It not only zaps the good cells, but the bad ones too. So I'm definitely starting to feel the fatigue mixed with getting back to work after everything. My body's been through a lot the last 9 months. It's still recovering from chemo. I still deal with a lot of brain fog and shortness of breath here and there, and I'm slowly gaining my strength back, but I have to be careful because of the surgery, how much I use these muscles up here. Everything's looking better as far as the new girls. I have a follow-up appointment with my plastic surgeon in about 3 weeks, and I'll be out of radiation by then, so he'll be able to take a look at the reconstructed part, the implants and the incision and everything, see how it looks and what we might need to do to perfect and well, I don't know how perfect they'll be, but you know, to soften the look a little bit. And I guess that's all I really have to report. I have been dealing with a lot of emotional and mental struggles lately. Maybe it's a little bit of depression, I don't know. You know, getting back into the swing of things is very exciting for me. I was coming out of my skin just after chemo and then surgery. I was so ready to get back to life, and I really went into radiation with a strong mindset and a good attitude, I felt. But, you know, I'm just constantly reminded with each treatment how none of them are easy, and all in their own way they have just these major downsides that really knock you on your butt and get the better of you. I mean, no part of the treatment process is easy. It's amazing. So after I finish radiation, I will, I guess, be up against hormone therapy for the next 5 years or so. I'm just going to take that one day at a time. I'm going to start it and go into it with a positive attitude and a strong head. And if I can't manage the side effects, I'm not sure. I'm not sure I'm going to continue. But they say if the cancer is going to come back, it will most likely come back within the first 5 years after your first diagnosis or something like that. Sorry if I'm not making any sense or trailing off. That's what I mean as far as the brain fog. So yeah, trying to stay positive, trying to be strong, trying to push through. You know, people are still being great as far as offering to help and reaching out, and you know, it's hard for me to ask after all this time. I think I'm sick of asking. I'm sick of being in this situation. I'm sure people are sick of me being in this situation and needing help. But yeah, it's a lot to go through, and you just have to constantly remind yourself to be patient with yourself and allow yourself that time to heal and not push. You know, there have been days where I pushed myself way too hard, and I just hit this wall, and I'm done, like done. You know, it could be 3 o'clock in the afternoon, but because I've been moving since 8, the rest of the day I'm just down for the count. So I need to learn from that, take it easy. Maybe take a day off work here and there, not push so hard, at least until I'm out of radiation. So I'll jump on here either before radiation's over or after it's done and give you an update, let you know how everything's going. I hope everybody's doing well and you had a great Easter, and I'll talk to you soon. Thanks, bye.